Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let's begin with a simple question. When anger rises, what do most people try to control first? They try to control the words. They try to control the face. They try to control the volume of the voice. But pause there. Ask a deeper question. Why did the anger become so fast, so physical, so difficult to interrupt in the first place? Why does one person feel irritation and still stay calm, while another person feels the same irritation and suddenly becomes explosive? Do not think of anger only as a bad attitude. Think of it as a whole body event. The brain detects threat, the nervous system prepares for action, stress hormones rise, muscles tighten, the heart accelerates. The amygdala becomes louder and the prefrontal cortex, the part of the brain that helps with judgment, delay, and self-control, has to work harder. So if we want better anger control, do not only say, calm down, build a calmer biological environment. This is where krill oil omega-3 becomes interesting. Not because it is magic, not because one capsule can replace therapy, sleep, exercise, accountability, or medical care. Use it as a nutritional support tool, one that may help the brain regulate emotional heat before that heat becomes behavior. Now ask, why omega-3 and why krill oil? Omega-3 fats, especially EPA and DHA, are not decorative nutrients. They become part of cell membranes. They influence how flexible those membranes are, how receptors behave, how inflammatory signals are produced, and how neurons communicate. DHA is especially important in brain structure, while EPA is often discussed for inflammatory balance and mood-related pathways. Reviews of omega-3 biology describe effects on membrane function, neurotransmission, dopamine-related systems, and inflammation. All areas that matter when we are talking about impulsivity, irritability, and aggressive reactions. So tell the audience this. Do not picture anger control as only a psychological skill. Picture it as a brain energy, membrane, inflammation, and impulse control issue. Then ask, how can a nutritional oil influence something as personal as anger? Here is the first pathway. Omega-3 may help reduce the biological background noise that makes anger easier to trigger. When inflammatory signaling is high, many people feel more reactive, more tense, more easily provoked. EPA and DHA can be converted into compounds such as resolvins and protectins, which are involved in the resolution of inflammation. That means they do not simply block inflammation like a blunt instrument, they participate in the body's own cleanup and settling process. That detail matters. Anger often feels like fire, but the body also has internal chemistry for putting fires out. Here is the second pathway. Omega-3 may support the communication between the emotional brain and the controlling brain. Ask yourself, how does self-control happen? It happens when the brain can pause. It happens when the prefrontal cortex can say, wait, do not send that message. Do not shout. Do not slam the door. Walk away. That pause is not just character, it is circuitry. Omega-3 fats are involved in neuronal membrane properties, ion channels, receptor function, and signal transmission. In plain language, the brain's wiring depends partly on the fats available to build and maintain it. Now bring in the strongest behavioral evidence. A 2024 meta-analysis in aggression and violent behavior examined randomized controlled trials of omega-3 supplementation and aggression. Look carefully at what was found. The authors summarized 29 randomized controlled trials, including 35 independent samples and 3,918 participants. The effect was modest, but statistically meaningful, and it appeared across children and adults, males and females, and different settings. The analysis also reported reductions in both reactive and proactive aggression, with particular signal in self-reported aggression. Do not exaggerate this. Say it clearly, omega-3 is not a personality transplant. It does not erase trauma. It It does not teach communication skills by itself, but a modest reduction in aggression can be meaningful. Why? Because anger damage often happens in seconds. One insult, one impulsive reply, one slammed door, one reckless decision. If the nervous system becomes even slightly less combustible, that small shift may protect relationships, jobs, families, and reputations. Now ask, why krill oil specifically? Krill oil is a marine omega-3 source that provides EPA and DHA, often bound partly to phospholipids, especially phosphatidylcholine. That is important because phospholipids are the same broad class of molecules used in cell membranes. Krill oil also naturally contains astaxanthin, the red-orange carotenoid pigment that gives it its color. Reviews and monographs describe krill oil as containing omega-3 fatty acids, phospholipids, and small amounts of antioxidant compounds such as astaxanthin, but be precise. Do not say, krill oil is always better than fish oil. Say this instead. Match the EPA and DHA dose, then judge the product. In one double-blind, randomized 4-week bioavailability study, healthy adults received about 1.3 grams per day of EPA plus DHA from fish oil ethyl ester, fish oil triglyceride, or krill oil. When the EPA and DHA doses were matched, plasma and red blood cell levels were broadly comparable across the 3 forms. That means the real question is not brand hype. The real question is whether the product delivers enough EPA and DHA consistently. So give the audience a command. Read the back label. Do not stop at 1000 milligrams krill oil. Look for EPA and DHA. Many krill products have smaller EPA and DHA amounts per capsule than concentrated fish oil. If the label gives only a big oil number but small EPA and DHA numbers, understand what you are buying. For anger control support, the active interest is not the word krill, it is the actual marine omega-3 content. Now ask, how should someone use this in a practical anger control plan? First, create a baseline. For 7 days, track 3 things: your anger intensity from 1 to 10, your trigger, and your recovery time. Do not judge yourself, collect data. Why? Because if you do not measure your pattern, you will mistake a good day for success and a bad day for failure. Second, take omega-3 with food. Tell people, do not take it randomly. Take it with a meal that contains some fat. Make it boring. Make it consistent. The brain does not remodel its fatty acid environment in one afternoon. Think in weeks, not hours. Many omega-3 trials run for several weeks or months, and the krill oil bioavailability study measured changes after 4 weeks. Third, combine it with a behavioral interrupt. Use this instruction. When anger rises, delay the first reaction by 90 seconds. Unclench the jaw. Put both feet on the floor. Exhale longer than you inhale. Say, I need a minute. Then leave the trigger if you can. Why combine nutrition with behavior? Because omega-3 may help lower the internal flame, but you still need a practiced exit route when the flame appears. Fourth, protect sleep. Ask, how can a brain regulate anger when it is exhausted? Poor sleep weakens impulse control. If someone takes krill oil but sleeps 5 hours, drinks heavily, skips meals, and lives on caffeine, do not expect clean emotional regulation. Build the whole platform: sleep, protein, movement, hydration, sunlight, therapy when needed, and omega-3 as one supportive layer. Fifth, be medically responsible. Give this command clearly. If you take blood thinners, have a bleeding disorder, have atrial fibrillation, are preparing for surgery, are pregnant, have a seafood or shellfish allergy, or take multiple medications, speak with a qualified clinician before using krill oil. NIH health professional guidance notes that common omega-3 supplement side effects are usually mild, such as fishy taste, heartburn, nausea, gastrointestinal discomfort, diarrhea, headache, or odor, but high doses may affect bleeding time, and large clinical trials have linked 4 grams per day omega-3 supplementation with a slight increase in atrial fibrillation risk among people with cardiovascular disease or high cardiovascular risk. Now return to the central question: why can this be beneficial for anger control? Because because anger is not only a moral event, it is also a neurobiological event. Omega-3 can support the physical environment in which emotional decisions are made. It may help membranes function better. It may help inflammatory signaling settle. It may support neurotransmission and stress response pathways. And the behavioral evidence, especially the 2024 meta-analysis, suggests that omega-3 supplementation can reduce aggressive behavior at a modest but meaningful level. But also ask, how do we avoid false hope? By being honest, not every study shows emotional benefits. For example, a double-blind randomized placebo-controlled trial in healthy midlife adults with low omega-3 intake found that 18 weeks of EPA and DHA supplementation did not significantly change negative affect, impulsive behaviors, or related brain system measures. That matters because it reminds us not to promise the same result for every person. Biology is personal. Dose, baseline diet, stress load, diagnosis, sleep, inflammation, genetics, and consistency all matter. So say this with confidence and balance: krill oil omega-3 is best viewed as an adjunct, not a cure. Use it to support the system. Use it while learning anger skills. Use it while repairing lifestyle patterns. Use it while getting help if anger has become dangerous, abusive, or legally risky. If anger leads to threats, violence, self-harm, or fear in the home, do not wait for a supplement to work. Get professional help immediately. Let's close with a picture. Imagine anger as a match thrown into dry grass. Therapy teaches you not to throw the match. Breathing teaches you how to step back. Sleep makes the grass less dry. Exercise burns off tension before it accumulates. Nutrition changes the soil. Krill oil omega-3 belongs in that last category. It may help make the inner terrain less flammable. So begin simply. Read the label. Confirm the EPA and DHA. Take it consistently with food if it is medically appropriate for you. Track your anger pattern. Practice the pause. Repair quickly when you fail. Ask every day, what made me reactive and what helped me recover? That question alone can change a life. Anger control is not about becoming emotionless. It is about becoming trustworthy under pressure. It is about making your nervous system an ally instead of an enemy. And if a small marine nutrient can help the brain create a little more space between trigger and reaction, then use that space wisely. Take care of yourselves, take care of each other, and let's keep growing as one family. See you in the next topic.